Hi, I'm Dr. Jeffrey Antimarino from Bellissimo Plastic Surgery and Medi Spa. And I just want to welcome you to our live Facebook event. As you know, every month we try to educate patients on various topics. And several months ago, we added a menopause makeover platform to our website and to our practice. And in order to help women find out information about menopause, which is a phase of life that every woman is going to go through. And I've been seeing it for a number of years in my practice. And so, in an effort to help women understand this phase of their life and so that they don't feel like they're the only ones that are going through it, we've been trying to get some information and education. So, today, we've reached out all the way across the pond to London, England, to Dr. Shahzadi Harper, who is well known and a specialist in menopause. And I'm just really delighted to have her with me. So we're going to let her do most of the talking because she's the expert, and I'll just kind of fill in with what I see. But Dr. Harper, welcome.
Thank you. Thank you very much for inviting me.
So
Very
let's just,
excited.
well, good. So just tell us a little bit about how you got here. I know it was sort of kind of a long kind of journey, and then you just really switched over to specialize in this.
Yeah, so I've been a doctor now for 26 years, and over here we call it family medicine, so general practice, looking after sort of families, and also it's combining a lot of specialities. And it gives you the advantage of maybe sort of seeing lots of different areas, addictions, sort of preventative medicine. And what I was really thinking was, when you get to midlife, it does seem like there seems to almost be an end point. Women seem to feel invisible, or they feel a loss of themselves. And there's lots of numerous sort of symptoms which no one was really seeming to join the dots together. And I'm one of six sisters, and I'm the eldest, so I knew I was going to be the first one going through it. And also, from a purely vanity point of view, I was single, and I was seeing these women coming in at 40, further down the line, that they just seem to lose their sparkle. And I personally wasn't ready to lose that sparkle, and I wanted to still sort of enjoy life. And that's what I wanted to bring together in my practice, in the sense of I wanted to join the dots up for them. And I wanted to show women that midlife is not the end of life. It can be a new chapter, it can be a new awakening, and you can still look good, feel good, and be sexy.
Yeah, well, that's terrific. So my question is, back years ago, we heard a lot about PMS. It was all over everything. Everybody was talking about it. We don't really hear about it at all. But menopause has never been anything that we've ever really talked about. And speaking to friends of mine that are gynecologists, they always say that they're the ones that have to initiate the conversation with the patient. But why do you think women really don't want to talk about it too much?
I think because of the negative connotations around it, because of that stigma and taboo, and maybe that narrative has been created over the years. I was almost going to say by men, in the sense that women are past it, they're old, they're dry, and so women don't really want to openly talk about it for fear of being seen as old. And I think we do live in a very visual society, and for women, looking good is also a part of their mental psychology and well-being. And I think that's the reason why they're not talking about it. And also, I think our generation of women, very, very different from our mothers, who maybe were more stay-at-home mums, whereas we're more career-driven, or we're out there much more. We are sort of embarking on new relationships at a later point in our lives. So I think there are lots of factors now why it's coming to the forefront. And also, we're a huge part of the workforce. So, from that perspective, it's also we're also an economic force. And I think, so I think that's why it's coming more to the surface. But in the past, I think it has had very much a stigma and taboo, and still does. We've still got a long way to go to sort of rectify that and just make it, like you said, just a part of the normal process of growing older.
Right, and I couldn't agree with you more. And so even though it's sort of outside of my realm, obviously as a plastic surgeon, but I'm seeing the other side of that. I'm seeing the women coming in, and what I was seeing was a common thread that women in sort of those mid 40s, 50s, 55, all had a very similar concern that, I mean, a lot of them were taking good care of themselves. The kids are grown or, you know, almost out of the house. And they sort of wanted to recapture that sense of femininity, but they were all having the same issues where they were, you know, gaining weight and still exercising and eating the same. So they were having difficulty now controlling their weight, or their weight number hadn't changed, but their body distribution and distribution of the fat in their body was different. And you know, we have a saying in plastic surgery: you sort of operate on the people in your age group. So, you know, I'm starting to see in my mid 50s, I'm starting to see, you know, a lot of people coming in for facial rejuvenation, eyelids, and men going through that because, as you said, men are working longer. So I'm seeing a lot more men coming in for facial rejuvenation. But this single thread, this common theme that women were talking about, so we wanted to put something together. So in your experience, kind of take us through. I know it's a long and it's a very involved subject. I'm not going to try to put it all in a nutshell here in the next 20 or 25 minutes, but take us through like what women sort of go through. We call it a pre-menopause and then a menopause, some of the most common symptoms and how you're treating that.
Yeah, so menopause is when your periods stop, and it's what we call a retrospective diagnosis. You look back and you've had a year without a period. But really, the more challenging time is that time leading up to it, which is the perimenopause. And, you know, that can last for about a decade for some women. And in that time, there are lots of changes going on. So, sort of lack of sleep. So insomnia is a big, symptom for a lot of women. Anxiety. There are lots of mental health, psychological symptoms. Flatness in mood. You know, I think when people think about sort of menopause, hot flushes and night sweats and grumpy, irritable, bitchy women, but actually it's a lot more than that. And also, you know, some of the symptoms that I see that might be the tipping point for women to come into clinic is things like hair loss, skin changes. It's almost like a stepwise aging process. And like you said, their body fat distribution changes. They're finding it harder to lose weight. And so it's a combination of outward physical changes that are going on, as well as the mental and psychological changes that are going on, that sort of drives them to the clinic. And every woman has her own tipping point. You know, for one woman, it might be the fact that she's got brain fog, her memory's not so great. You know, she's feeling a lack of confidence in her abilities at work. For another woman, it can be her skin and her hair. For another one, it could be, you know, the lack of sleep. For another one, it could be her libido. You know, she's lost all interest in desire in sex, and there's also vaginal dryness and discomfort going on. So all of these symptoms can start, you know, quite a way bit before your periods end. And just because your periods stop, the other thing is the symptoms don't stop. They can carry on into your mid-50s and beyond. And that's what I see in my clinic. And what I want to do is to have a 360-degree approach. It's not just about the hormones on the inside. It's also very much the visual exterior as well for them, you know, to get their mojo back, to get their sparkle back.
Right. And you were talking about skin because we see a lot of patients that, come in for facial rejuvenation because their skin has sort of lost that luster. And I think a lot of them, especially women that are starting to go through this in their early to mid 40s, really not ready for surgical intervention. But what we've been finding is that, you know, getting them on good skincare and doing some, you know, lightly invasive, whether it's a CO2 laser or some resurfacing, kind of restores that shine. But what kind of skin changes are you seeing in conjunction to that?
So like you said, so estrogen is responsible for our collagen production, and collagen is the scaffolding for our face. And so along with hormonal changes, it means that our collagen depletes. So we lose that scaffolding, that structure to our face, and we lose that plumpness. So everything sort of falls in a V. It's that sagging look. You know, women say to me, oh, I've lost my jawline, and also their skin becomes thinner, drier, crepier, so more fine lines, more wrinkles, and they lose that volume from their face. So, you know, eyes look a little bit more hollow, the cheeks have lost that volume as well, and, you know, everything seems to have just gone down south. And, like you said, women aren't ready for that, at that point, early 40s, mid 40s, 50s. I think in general, women aren't ready for that. And then often they have that conversation, face versus figure. If they lose some weight, they're going to lose more volume from their face. So, and it's not just the face that changes because of the collagen loss. We lose it throughout our body. Our skin is not as pingy and as elastic as it used to be. So, we can get all of these changes happening in our face and the rest of our body.
Right. And I see ladies, we talk about obviously in plastic surgery, a lot of it's face and breast. I'm seeing a lot of fat deposition above the belly button, between the ribs and the belly button, which is very fibrous and very thick. And women are very uncomfortable in their clothing, but especially when they sit down, if they feel like it's pushing up under their ribs. And no matter what kind of diet or exercise program, it just doesn't go away. And for me, I used to years ago always blamed it on the hormonal changes, and it really seems to be holding true that's the issue. But I'm also seeing changes in the skin all over the body, and so up in the upper chest, the décolleté area, the arms, that a lot of ladies, especially ladies that are thinly built all the way along, now are starting to lose volume, where they're getting some crepey skins on their upper arms and down on the lower legs in the front above the knees. They come in and they wanted that to be rejuvenated so that they can wear bathing suits and skirts. And it's a very difficult process to treat because it's you're trying to stimulate, as you said, that the collagen has thinned out, and now you're trying to stimulate something that there's not a lot of. So even stimulating something 20-25% that's less is still not a great result. And we can see some improvements, but is it acceptable? Is it enough for women to be happy with that? Because there's really no other way to go at it.
And along with that collagen loss that you've mentioned there as well, women also lose muscle mass. Mm-hmm. So even a thin woman, so I see, thin women who say to me, I might still fit into the same clothes, but they don't fit right because they've lost muscle tone. And that's also something that happens, it's called sarcopenia, and women lose muscle bulk as well. So it's a combination of losing muscle and then getting fat deposited in other areas. And one of the reasons why women start to gain weight around this time is because our ovaries produce estrogen, but body fat also produces a weaker estrogen. So our body is trying to create estrogen from other sources. And that's why breasts can feel more fatty and heavier. And like you said, you've got the sort of middle weight gain that's accumulating, or back fat that women talk about. So it's all in the areas that they don't want, and it's very stubborn, and it's very difficult for them, to lose.
Right. And that's the problem that I see is, women are coming in and they're just exasperated. They've been exercised and they're almost starving themselves to death. And that just weighs again on their psyche. And one of the things that I love about being a plastic surgeon is being to impact in a positive way somebody's self-image. But this is very difficult, and trying to get those ladies to feel really good about themselves again, because it's almost like an uphill battle all the time. So what kind of things do you, and I know it's a lot of different things that you treat them for, but what's the most common things that you can kind of tell patients that, do you believe in hormonal replacement? Is that helping so that they're not producing as much fat, maybe estrogen from their fatty deposits?
So it's a combination of approach, and it's very individual to each woman and what her needs are. So along with those hormonal changes, they're also affecting other hormones like insulin. So, insulin is the hormone that helps us sort of transport food into our cells to create energy, and insulin is not working so well. So instead, food is sort of turned into fat, and we get bigger fat deposits. So there's a combination of factors going on there. And, as a doctor, we always talk about lifestyle. We always say about exercise, diet, stopping smoking, reducing alcohol intake. But, women can feel very demotivated at this time. They can feel tired because they're not sleeping well. And they just don't have the energy to make those positive changes that we want them to do. And so, yes, one of the things I do advocate is, sort of for a lot of women, it's hormone replacement therapy, at the lowest, safest dose, weighing up the pros and cons for each woman, sort of guiding her through the process. I very much explain that this is a journey. And often it gives them that impetus then to start making those other changes that we are talking about. And then they start to sort of fall in love with themselves, you know. So often at the second appointment, we may talk about weight loss. And sometimes some women do need medical help to lose a bit of weight. Also medical grade skincare. You know, and the other things are sort of from the facial rejuvenation point of view. Women do want advice on what is appropriate. Women lose volume from their lips, and lip volume loss can make you look so much older. So just a few tweaks here and there, funnily enough. It's not about looking plastic, or it's not about looking, it's about looking natural and feeling naturally good. So that's what most of my women want to look. And also from the breast point of view, they can feel really heavy, much bigger than they're used to having in the past. So some of them do want to have uplifts or reductions, and some women may need enhancements as well. So, and I think it's quite a good time in life to have a reappraisal and a reevaluation of yourself.
Right, and I couldn't agree with you more. And I think my patients, we talk to them about just a very natural look. And I think, you know, as a plastic surgery specialty, I think sometimes we become marketers, and I think we're losing the fact of, you know, what are we really trying to achieve here? And so I think just enhancing what a woman wants and really listening to what, you know, just trying to get her back on the right track so that she does feel good about herself. We're not trying to make her look 30 anymore, but just give her some volume and bring back that skincare and that glow to her skin. Help her out with some different tweaking of their body. I found that their breasts have kind of gotten wide and flatter. Mm-hmm. And so in clothing that makes them look top heavy, and it kind of stunts their height so that they actually look more rounded. And so a lot of women end up having to wear sports bras, and that actually makes it worse because that just compresses and makes them wider. So sometimes just doing a breast lift and narrowing the width of the breast and bringing them back up is such a rejuvenating feeling and look for them that really sets their spirits much higher.
Yeah, I mean, I think, you know, when it comes to hormone replacement, often I talk to them about the fact that your ovaries are no longer producing hormones. So you've gone into a hormone deficient state. So the factors that were sort of dependent on hormones, collagen, elastin, hair, you know, muscle mass, that's all declining. So, you know, very much weigh up the benefits versus the risks for hormone replacement for them. Dispel some of the myths, you know, sort of that have been bandied around. And I think that's really important, because I think otherwise women are being denied the treatment that could really help and benefit them because they've been misinformed.
Right, and that was the whole point of this. Is I'm not trying to be a menopause specialist, but there's so many women that just don't have the right information. And I think, I don't think it's being talked about well on social media and those kind of platforms. And so I think that might harbor some of these bad connotations about it. Do you find that with hormone replacement, do you find that their hair quality is improved as well? Because that's the one thing that I see on every one of my intake forms. Women of all ages talk about thinning hair, losing hair. Does that ever...
So you know, hair loss and hair thinning is a multifactorial. So they're multifactorial reasons. You know, at this time of life, midlife can be a more stressful time for women, and we know that causes hair loss. You know, the other things, they're not sleeping so well. But yes, you know, hormonal changes. They lose that sort of the hair becomes drier, more brittle. The hair follicles become a little flatter, so hair becomes thinner. And you know, we have 3 different phases of a hair growth, and so the loss of our hormones means that we're no longer in that sort of growth and steady phase for as long as we want it to be. So we are more in that shedding phase. So and also women may have heavy periods around this time. You know, don't forget that their periods can be irregular, more frequent. They can also be quite heavy. And so the loss of iron depletion also contributes towards hair loss. Some women may get underactive thyroids, again, coarse, dry hair. So there may well be some nutritional deficiencies going alongside the hormonal perimenopause process as well.
Wow, I mean, that's a lot. I mean, I know women are dealing with a lot of things. It seems about every decade of life, women's bodies go through some type of a change, and this one, and then it's ongoing as well. I mean, it doesn't when you're kind of through the menopause, it's long. It's really for the rest of your life. It doesn't kick in and correct itself, and um, so I think that what I'd like you to do is we were just kind of coming to an end for this phase of it, but what would you say, to any of the people that are tuning in and the listeners and stuff, what advice would you give women about menopause, getting to see their physician? What would you, if you were just kind of talking, what would you say to them?
I'd say to them, go sooner rather than later. Don't put up with these symptoms. And I think as women, often we do put up with it because we put it down to life. Maybe be a bit more aware and, find out a little bit more information about what these symptoms are, because there's a lot that can be done from a sort of pharmacological point of view, also from an external point of view. I very much I very much talk about both approaches, sort of together in parallel. And I think, what I would say to women is also this probably comes on a little bit earlier than you think, because I think women think of menopause, often women are menopause deniers. They think it's much older women. It must be, these grey-haired 60-year-old women or something. But no, they can happen to you, sort of in your 40s, 50s. So, you can be one of those women. And so don't think about it sooner, and take action is what I would say, so that if you start taking action earlier, it's smaller and smaller, little things will help, and it's more of a preventative approach rather than suddenly going in at one point and having to have such a major sort of interventions.
Yeah, I think that's great advice. I really do. But listen, I really want to thank you for taking the time. And this was great. I learned a lot, and I hope that anybody listening will take that advice, because I think you're absolutely right. I think getting on something early rather than trying to all of a sudden put the genie back in the bottle, so to speak, and not understanding it. Plus, you've had all these years with just these bad connotations. So. But I really appreciate it, and I think you're doing some great work over there. And I would love to touch base with you again sometime.
I would.
So, hopefully we can set something up that we can just follow along and maybe pinpoint certain things, because I think this is something that is going to be a platform we need to continue on and on and on, and not forget about it just because we've kind of hit it now for a few months. But I want to keep on this, because I think as more and more women learn about it, it will be something that will be talked about, and women will be not afraid to go in and talk about things.
And I really like the fact that you're talking about a menopause makeover and making it sound, normalizing it. The fact that women, it's okay to want to make some changes. It's okay to look good and feel good. And I think, that's what I also sort of believe in. You're not being vain. It's just, a part of sort of a treatment process. So I think it's great combining the two.
Our attitude with it. We just wanted to have people, ladies, that say, you know what, this is what we can do to help from our end.
Yeah.
We always refer them back to their primary cares, their gynecologist, for all of the hormonal and everything else. So I really appreciate that. All right.
Thank you. Thank you very much for having me.
Very much. Listen, thank you for joining in. And if you would like to see this again, it will be posted on our website. And Dr. Harper, again, thank you so much. We'll have all of the social and the web addresses posted so that you can follow along. And see you next time.